Thanks for downloading this week's episode of the Mental Health Book Club podcast. Before we get started with the main episode, I'd like to draw your attention to some research from the University of Melbourne. They are calling for participants to take part in a research study called Social Media, Young Adults and Wellbeing. If you are aged between 18 to 34 years old and have 15 minutes to spare, you would be helping out immensely by filling in the survey. The survey is completely anonymous, and it's looking to find out how you guys use social media and how that impacts your mental health. If you are interested in taking part in this survey, I shall put a web address into the show notes for you. The idea is to help with identifying ways to help make social media safer for young adults like yourselves. I've taken the survey because I am just in that bracket, woohoo! And it did take about 15 minutes, and it asked lots of different questions about your use of different social networking, whether you use blogs, whether you use wikis, all of those kind of things. So if you feel that you can help out, just click the link in the show notes. Hello and welcome to the Mental Health Book Club podcast with your hosts Sydney Timmins and Becky Lawrence. We would like to take this opportunity to let you know that we will be covering a diverse range of mental health topics that may be distressing to some listeners. You can find a full list of the topics being covered in each episode in the show notes. Please check the show notes before listening to any of our episodes. Welcome to the Mental Health Book Club podcast with me, Sydney Timmins. And this is going to be the last episode in the 3 episodes that myself and the Secret Psychiatrist recorded about my courage to tell. And so in this episode, this is the final topic that the Secret Psychiatrist would like to cover. So I am extremely pleased to welcome back to the podcast the Secret Psychiatrist.
Hello, thank you for having me again. I'm the Secret Psychiatrist.
Fantastic. Thank you so much for coming back. And I believe this topic that we're going to cover for today's episode is the issue of conduct disorder and oppositional defiant disorder.
That's right. And just like with the other podcasts, for those listening, I do touch on a few sensitive topics with the graphic detail in this particular one. So please keep that in mind. And if you're around children or vulnerable individuals, please perhaps go into a different room so you're alone to listen to it. And if you have any concerns or problems at the end that you want to talk to us, we're more than happy for you to write to us.
Today, we were going to look at the conduct disorder and the oppositional defiant disorder because you identified that as a possible issue in Laura's brother that would have led to the behaviour that we see during the book.
That's right. So when I was listening to the podcast, when you were discussing it with Becky, there was a specific image, which I'll talk about later, that really made me think of conduct disorder. And I thought at the same time, because oppositional defiance is quite similar to conduct disorder, so I thought it'd tie in quite nicely.
Yeah, and that probably links into some of the things that, as a result of me looking into the conditions, has highlighted is the fact that people seem to get a little confused between the two and aren't able to identify the differences.
Yeah, that's quite common. So I will go into the differences of both of them. But if you like to think of it quite simply as they're very similar, oppositional defiance is essentially, and this is very summarised in layman's terms, a milder form of conduct disorder. So you won't have the aggressive animal cruelty, for example, behaviour. It will be quite mild, sort of just shouting almost, tantrums, being angry, but most likely in the home environment. So it's not an extreme form, whereas conduct disorder is.
Okay, well, that's good to know. And I like you putting it in simple terms because then at least I can understand it.
Yeah, I'm always a bit worried I go into some medical jargon, so I'll try and keep things simple.
That's all right. That's why I'm here. I can go, hang on a minute, I don't get that. So, yeah, don't worry, I won't let you go and get away with too much medical jargon without me going, I don't understand that.
And stop me, yeah. So something really struck me, and it was the image, the really horrible image of this boy skinning a frog's skin off to see when he would die. And that kind of behaviour, along with what the sibling was treating this young child, really ties in, I think, with conduct disorder. Obviously, I don't know if this boy diagnosed with that, or I haven't assessed him and I don't know the full story, but that sort of behaviour goes very, very well with conduct disorder.
I don't know much about conduct disorder. Could you tell me a little bit more about it?
So conduct disorder is characterised by aggressive, defiant, antisocial, severe, persistent pattern that defy age and what's appropriate for that age as well. What's quite similar is oppositional defiant disorder, but there are differences, which I'll go into. And what that involves is the persistent pattern of defiant behaviour. Now, conduct disorder, normally you're very physically aggressive, or you threaten to harm people, cruel to animals, and that's something to highlight. And that doesn't happen in oppositional defiant disorder, but it happens in conduct. So animal cruelty. So, for example, you put fireworks in a cat and you want it to explode. Quite horrible images, really.
That is horrific.
It's horrific, and there has been cases of that. Other things as well for the diagnostic criteria is theft, deceitful, destruction of their own property of others, frequent rule breaking, truancy, running away, that kind of behaviour.
So there are quite a lot of different things that indicate that a child is suffering with conduct disorder.
Yes, and it's one of the main risk factors for actually when you're an adult having antisocial behaviour. So conduct disorder actually occurs with greater frequency in children of parents with antisocial personality disorder. And maybe in another podcast we can talk about antisocial personality disorder as well.
Yeah, I definitely think we should do another one on antisocial personality disorder. So are there any other risk factors associated with a child developing conduct disorder?
Yes, also greater frequency with those with alcohol dependency compared to the general population. And there was a really interesting study actually in the Isle of Wight which found conduct disorder is one of the most common psychiatric disorders with children around 10 years old. So the prevalence is about 5%, that's noted in the UK. Much more common with boys and girls. Again, it's about 4-1, so 4 boys to a girl. And certain risks is having parents with mental health, family dysfunction, low income amongst the family, criminality, especially with the father, again, overcrowding, the child having been put in institutional care growing up, very poor relationship with the mother, so mother's not been stable while growing up, or maternal neurosis as well. Having conduct disorder run in the families as well can be a risk factor. And with the child themselves, if they have quite a sort of callous temperament, quite unemotional as well. And it's also been found that you have low CSF serotonin, which basically means a low neurotransmitter in your brain that can affect your mood. And there's a low level compared to other children. So that goes with why certain mood is associated with conduct disorder. And you might have more aggressive behavior as well. And it's also found that you have low salivary cortisol levels in conduct disorder, which means in your saliva, you've got low cortisol levels, which is a stress level taken as well.
Now, I'm aware that we don't really have the time to go into the intricacies of how the brain works and with hormones and all of that kind of stuff. But could you give us a brief explanation of why you would look at cortisol levels and what cortisol does?
So cortisol level is known to be a stress-related hormone. And there's not enough research at the moment with conduct disorder. So some studies have said that there's a decrease in cortisol levels being secreted, but there have been noted cortisol levels increase at specific times compared to those that don't have conduct disorder. But little of it is unknown, but we know it's a stress response. And with serotonin helps regulate mood in individuals, normally anyway. And if your levels aren't at the baseline of what they should be, it can really affect your social behaviour because it affects your mood and your functioning related to your mood. So with conduct disorder, it's thought that there are low levels associated with high callous unemotional traits. So if you think about it, if you have this emotion regulation that's normal, that helps us to respond to emotions normally that are socially accepted. But if these are affected, for instance, with your serotonin levels, cortisol levels, that's going to be affected of how you respond and behave with other people. Also, the child might have low IQ compared to others as well. And it's found on scans that children are more likely to have prefrontal brain regions with reduced volumes, which basically means lower sort of volumes in the front of the brain compared to other children.
Again, I'm aware that we haven't got time to go into brain structure, but why is the reduction in volume at the front of the brain so important in conduct disorder?
Okay, so compared with healthy individuals, there's something called the grey matter. So grey matter essentially contains neuronal cell bodies in a human being, and it helps with synapses, processing information in the brain, essentially. Now, that's been shown in conduct disorder that the grey matter volumes reduced about 6% smaller compared to others. And there's also there's also reduced grey matter volume in the left orbitofrontal region. The orbitofrontal region essentially is involved in cognitive processing and decision making in individuals. Also, there's also a decrease of grey matter volume in the bilateral temporal lobes. Temporal lobes is involved in processing information, helping things be more meaningful to us, and helps with your sort of words and the speed processing information as well. And there's also noticed that there's reduced volumes of the grey matter, including the amygdala and hippocampus. So the amygdala is responsible for emotions, your survival instincts, your memory, sort of the fear response, essentially. And errors in this can lead to possible impulsivity, cognitive dysfunction, issues with the fear response. And the hippocampus regulates emotions as well and is associated with memory. So again, if you think about this, if there are issues concerning all of these areas within the brain, it can demonstrate sort of reduction in brain regions involved in processing, therefore affecting your social, emotional responses and the stimuli. So other risk factors for children having conduct disorders, the mum smoking in pregnancy. As I said, mum or dad having a criminal background, but also dabbling in substance abuse as well. So drugs, alcohol, being quite harsh actually in the parenting to the child. That can be quite inappropriate as well. And that puts the child at risk. Domestic violence in the family with overcrowding, a large family size as well. Low sort of status. So low socioeconomic status, social disadvantage, having quite early loss, very poor achievements within school as well. And as I said before, which goes with abuse, social isolation, so with family and friends and not having that support system.
So there are quite a few risk factors associated with developing conduct disorder. But what happens later on as the child ages?
So as I said, later on in life, it does increase your chance of having problems when you're an adult. It increases your risk, about less than 50% more likely to have antisocial problems as adults, such as antisocial personality disorder. There's increased chance of them being homeless, abuse, whether they're doing it or receiving it, problems with their own finances, substances, dabbling in substances, quite poor physical hygiene and health as well. Suicidal behaviour is also witnessed with that as well.
So what treatments are available for conduct disorder?
So treatment, it's very multimodal. So, it goes from school, home. So support at school, especially with the social skills, psychological support as well. There's parent management training. So knowing how to support your child and how to appropriately sort of parent them as well in a supportive way. And CBT, so cognitive behavioral therapy, that can also help in children and adolescents, especially helping with their anger management as well and their aggressiveness. And it helps calm their emotional dysregulation, really. There's also functional family therapy, and that's one of the best known interventions, actually. So with that, you normally have about sort of 8 to 12 hour sessions, and you go to the family's home. So, it's more supportive as well for the family, and it can last up to 3 months as well. So what that does, it really helps the communication between the parent and the child. So therefore, there won't be so much inconsistency with the parenting. And it really looks, so you're quite supervising sort of how the parent interacts with the child and how best to negotiate what the child should do. So certain rules, i.e. you need to come home at this time, do your homework, etc. And it has been shown to reduce sort of reoffending rates by about 50% actually. So it's very, very helpful. And there's also multi-systemic therapy. Again, an excellent treatment, especially for conduct disorder. And that's when a clinician is available 24 hours a day for the child and the family. And essentially what happens there, the family is assessed and all the relationships between the child with their family, the school and the peers are looked at. And then you apply certain interventions as well to help the child. Now, before I go on to oppositional defiant disorder, is there anything there that you found surprising?
Yes, so at the end of the book, when Laura is processing all of the stuff that has happened with her own therapist, her therapist suggests that there may still be some issues with antisocial personality disorder because of the way he interacts with her as an adult. So I didn't realise it was as high as less than 50%. I think that's an incredible amount. But also the fact that there is so many treatment options for treating conduct disorder. I mean, you've obviously gone through all of the signs to look out for someone with conduct disorder. Is there a particular time when that intervention is best? Obviously, sooner is better, but when would be the optimal time to get in there?
I think, sooner than later, really, because what you don't want is a child to be getting into these habits and then before you know it, they've become an adolescent and it becomes much more difficult because they start to become, an independent person. And it is an increased chance of antisocial personality disorder as well. So I think the sooner the better, really, and to get that support fixed in, and also for the child to have a better childhood for themselves as well. So I always say it's just like if you see something on your skin, check it out, get it done sooner rather than later, because you don't really want to be waiting to see what might happen. And also, it's not just the child affected. People around them will be affected as well, because conduct disorder isn't just about the child. They could be aggressive to other people involved as well. So you're putting the other people at risk as well.
And if you were seeing those signs and symptoms in a child that you know, what would you do to intervene? Would you go, first of all, off to the doctor, GP? Where would you find out additional information about conduct disorder?
So do you mean if I, as a psychiatrist, was seeing them, or just anybody?
As anyone. So if I was to sit here and go, I'm starting to see these things in someone I know, how would I be able to help support their family if they're not directly related to me?
Right. Yeah. I mean, that's always a very sensitive topic, really. I mean, if you know...
Yeah.
I mean, it's like if it's your neighbour, or say, like I always say, if you see something, I always report it. So if it was me, I mean, it obviously depends on the situation and the circumstances, but if you're able to, I would try and make that link with the parents, and hopefully they'll be, opening that door and willing to listen, and hopefully they've seen the symptoms themselves, because, you can't really miss them, and they'll be going through it themselves. So if they're approachable, I would definitely just sort of say, I have a few concerns and I was wondering if I could talk to you about it. Something very open.
Yeah.
I would never be judgmental on individuals. You don't know people's circumstances. And I don't think that's the right way to go. But, having an open mind and being quite sensitive about what you're talking about, because it is someone's child, obviously.
Exactly.
But I mean, hopefully, this is just being optimistic, that the parent has already done something about it, or was liaising with school, because school normally notices these things as well. It's normally school that picks up on these things and, talks to the family. But I think if you're able to, I would definitely discuss with someone. If it's a situation where you're very worried that you can't talk to the parents and no one has picked up on it and the child's at risk, then one of those things that you need to make an ethical choice for yourself, whether you get social services and just contact them to see if they could just do a little check just to see everything's okay, because they might already be known to some sort of support service as well. But it's normally schools that pick up on these things.
Also, if you were that parent and the school has come to you and said, we think there might be some kind of an issue in your child's behaviour, how would you as a parent go about trying to find the additional resources that you would need? I know that the school would offer support and they would point you in the right direction, but I don't know, some parents might find it quite difficult to handle.
Yes, no, I understand. So normally school does point you in the right direction. What you could do is, so CAMS, so child and adolescent services. So that's normally where at some point the child might go into, so it's a psychiatric, it's normally an outpatient clinic of some sort, and it can be done at school or in a clinic somewhere. So you can go online and there's different services on the NHS, but it will be under CAMS, so child and adolescent. And what they'll do is they'll put you in contact, they'll assess you and the child, and normally they'll work with you with a psychologist, possible psychiatrist as well, depending if medication might need to be involved or there's a worry of risk to the child on themselves or to others or the parent onto the child. And normally psychological treatments will then be given that way, such as cognitive behavioural therapy. And sometimes that's also provided at school, so it's much easier for the child as well, and they don't have to miss school as well. But normally the GP can make these referrals, and sometimes the GP has these services within their own practice, or it's a school, or you're welcome to look at the NHS websites as well.
I'll put a link to all of those in the show notes for you to have a look at. Another question, sorry, full of questions. In terms of the conduct disorder, at what point does it become something else? Because you said obviously it can become antisocial personality, or does the person continue to have conduct disorder? So
you don't necessarily continue to have conduct disorder. You can, come out of it and no longer have it. But again, it's very individual. It depends on the person, whether you've got that support in place and whether you have insight and the family have insight as well. But sometimes in these cases, no one does come forward. And unfortunately, the parents don't support the child. So less than 50% do continue to have these sort of traits of conduct disorder, which later on become most likely antisocial personality disorder, really. But there, you can come out of it. But again, it's very individual, and it depends if that person gets the support and things change, obviously, in their day-to-day routine.
So if a parent is noticing that there may be some issues with conduct disorder, all hope isn't lost just because you're seeing the signs.
No. Yeah. No, I think, and also you've got to think about, why is this happening? Does something happen in the pregnancy? Does something happen in the developmental side of the child? Is it with your own parenting? Has something happened in the family? There's so much to look at. And also, especially with children, you've got to look at, are they eating right? Height and weight, is that okay? The vitals okay? So blood pressure. So all these things need to be looked at, as well as, their blood. Is everything okay? Are they deficient in anything? Is anything happening at school? Are they around others where they're seeing this behaviour as well? But normally, not for every case, I'm not saying that, but normally there is a reason these things are happening, and it's normally something is happening at home, and this is the behaviour that they have witnessed. I'm not saying that's the case for all of them, so I'm not saying that, but something's not right. And parents, some parents unfortunately aren't the fantastic parents that we want and need and we expect, but it's up to the parent to, as well as, school and those around them, to really be helping to make those difference, because family therapy and child, if they're going through that treatment, psychological treatment, and they need the support, they need that love and support home, really.
Yeah, no, that's very interesting. I don't know, as someone who has borderline personality disorder, I keep going on about it, but if I was to be told that my child was showing signs of something, I would automatically blame myself and be like, well, I've gone and screwed them up and stuff. But that may not be the case, basically, is what you're saying. So that's just really interesting.
Oh, no, I don't, don't ever think that. No, because sometimes you're not to blame. Like, sometimes these things do happen. You sound like you're someone very conscientious of how they are with people, and you sound like you'd be a very supportive, parent. But, there's no point blaming yourself if you're a good parent and you're supportive. You've done what you can. But unfortunately, there are so many people that aren't like you, and they aren't that thoughtful and reflecting. Like, sometimes there are situations that happen.
Yeah.
Some people are alcoholics, or I'm being very controversial here, but you know what I mean? Like, I'm just giving you the very broad end of the spectrum here. But definitely do not blame yourself. And if you have mental illness, definitely do not blame yourself. Like, you can only do so. I mean, no one's a perfect parent. You know what I mean? No one's a perfect child. You can only do what you can with the resources you can.
Yeah, definitely. I mean, I think it's probably because of, again, the media sensationalizing certain stories and things. And it's one of those things that concerns me. And I don't know about our listeners, but they might find it interesting as much as I do, just how much impact a person who has had mental health issues in the past can actually provide good enough care looking after their child, if that makes sense.
No, that completely makes sense. I mean, I'm not also saying, something to keep in mind as well, and I'm not being contradicting here, is mental illness does increase, your chance of your child being exposed to mental illness. Okay. And I mean, there's nothing you can do about that, but it's not a lot, but it's there. That's just like saying, if you smoke in your house, you put others at risk of getting smoking cancer, so it's there, it's a risk. But I think if you have mental illness and you want to be a good parent, I mean, the best thing I can always say is you be aware of your relapses, your triggers, and you just make sure you're as stable as possible. And you do the things that make you happy and good. And if you're taking medication, then, take your medication and go to your appointments. Just as if you've got diabetes, you've got to look after yourself as well. You've got to take the medication and you've got to go to your appointments. And that's with anything as well. So if I've got cardiovascular disease, more likely that my family might have it as well if I inherited it. So that's with everything in life, but especially with mental illness, just make sure, just like with physical illness, you do what you need to, and that's all you can do.
Well, that kind of makes me go, there's still hope in some ways for me.
Of course there is. I think, you talking about this, maybe another podcast, we could do perinatal psychiatry. Yeah, and talking about that.
I think so. Yeah, I was just about to say, maybe we could do another one on this particular topic. So, you said we were going to go on?
Yes, I thought quickly we'll talk about oppositional defiant disorder. We'll finish on that.
Sounds perfect.
So, oppositional defiant disorder, so very similar to conduct disorder, but I mean, this is lay term, so I think just imagine it in a way that it's just much more milder form of conduct disorder. So you don't have this animal cruelty sort of behavior. So it's characterized by sort of negative, hostile, defiant behavior as well, but it doesn't have the serious sort of consequences of breaking out the social norms of rights of others. So for instance, you're not, aggressive, violent to other people or animals like you would be in conduct disorder possibly. Normally, you need to have it for about 6 months. Normally, the child might have a lot of outbursts, so, really angry, shouting, doesn't want to do certain things. And normally you see it at home, actually, you don't see it at school. So they'll be the good student at school, but it will be at home with the parents, for example. And they'll blame whoever's at home. They'll be really annoyed with also other children of their own age who are at home.
You say that oppositional defiant disorder is mainly seen in the home. Is there any times that it's seen outside of the home at all?
Yeah. This can happen outside school only if they're very comfortable with, say, their teachers and they see them just as they see like their parents, very, very comfortable as well.
So when might it become obvious that a child is beginning to suffer from oppositional defiant disorder? Is there any difference between that and the time of conduct disorder? And is there a difference in prevalence between gender?
It normally begins, you can see it from sort of the even early as 3 years old, but it's normally around 8 years old you kind of notice it much more. Oppositional defiant disorder is generally earlier in age than conduct disorder. So prevalence is slightly lower than conduct disorder, about 2 to 5%. Again, slightly more prevalent in boys than girls before puberty, but after puberty, interestingly, it's sort of equal between boys and girls. And about 25% of cases actually show no symptoms later on in life, but some can progress to conduct disorder later on.
Are there any other conditions that might be associated with oppositional defiant disorder?
Now, some studies have suggested that ADHD, so that's attention deficit hyperactivity disorder, for those that don't know, in early life can actually be a predictor for oppositional defiant disorder and conduct disorder later on in life. Chronic oppositional defiant disorder usually interferes with interpersonal relationships at home found. And you can also get difficulties with low self-esteem, poor frustration tolerance, low mood, again, like I said, temper outbursts, things like that. And with adolescents, you might find that they're dabbling in alcohol or drugs, so you need to be mindful of that. And also, again, be aware of conduct disorder might be coming into the picture later on.
In terms of treating oppositional defiant disorder, what is the long-term prognosis for a child?
Now, there is a poor prognosis if a child gets it very early on in their age, if they've had it for a long period of time, if also they've got a comorbidity of impulse control problems, substance misuse problems, conduct disorder or anxiety. Now, the management for oppositional defiant disorder is pretty much exactly the same with conduct disorder, really, so I don't need to repeat that.
Yeah, I agree. Is it all right to ask a few questions at this point? You said that oppositional defiance disorder can progress into conduct disorder if there are issues with impulsivity and outburst and those kind of things. So in terms of those, what is it about those things that will cause it to become
conduct disorder? So it wasn't that oppositional defiant disorder that you get conduct disorder if you also have impulse control problems or substance misuse problems. So that's something different. So you can get conduct disorder regardless in oppositional defiant disorder, and you can also have a poorer prognosis. So what I was trying to say is you get a poorer prognosis in oppositional defiant disorder, which means there's a poor outcome in oppositional defiant disorder if you have one of these things, not all of them, but one of them. So you get it at an earlier age, you've suffering for a very long time, so years. If you also have anxiety, if you also have impulse control, if you also have problems with substances meaning drugs or alcohol, and if you can have elements of conduct disorder later on. But you can get conduct disorder anyway, regardless in oppositional defiant disorder, if it continues the way it's going without any help.
Right. That makes sense. I can definitely understand why that could happen. So one of the common things that I have seen on the internet, but also heard in person, particularly when a parent is explaining to another parent, my child has oppositional defiant disorder or my child has conduct disorder, that parents or some parents can be a little bit judgmental of the situation. And I have heard parents say that it is just a way for people to pathologise their kids when they misbehave, and it isn't a real condition.
That's quite a common topic that comes up. So, okay, part of that, I understand where people are coming from, because it's more in the westernized countries that you see conduct disorder compared to, for example, India. And there's a theory, because there's not that much research into this either. So we have to go on what we know. So part of it is social. So people think maybe it's the parenting that perhaps, for example, in India, parenting is much stricter. So children can't, for example, shout or behave in a certain way, and that's managed in that way. Whereas in the westernized countries, perhaps people are a bit more flexible, let's say. But as I have said, there are known causes, genetic, and that contribute to the behaviour. So that is known, as well as biological contribution to conduct disorder. So we can't really ignore that. And there have been proven coexistent mental health issues with conduct disorder that have to be assessed, such as ADHD and autistic traits. The list goes on, as well as the relationship between the parent and the attachment style as well. So these things all contribute actually to having conduct disorder. It's not simply you haven't been a good parent and it's a social issue. There's biological and genetic factors also.
That kind of leads on to the other one that I was going to mention, was that people think that children that are displaying traits of conduct disorder and oppositional defiant disorder are just bad kids, which I think is a bit harsh.
No, I don't think so. It's not about being a bad kid. As I said, there's a genetic factor, a biological factor, and a social factor. So there's so much going on here. It's not simply a child deciding to be naughty. There are other contributing factors here and that we can't ignore.
Definitely. The other two things that, again, you mentioned in what you just said was this parenting role and this misconception that other people think it's just that the parents aren't doing a good enough job, that they're either employing too much discipline or they're not disciplining their child enough. And it isn't that simple.
No, it's not that simple. I mean, there are so many different parenting styles that there's no one perfect example. But if you think about it, you can have a particular parenting style, but your child might have a mental health issue or they might not. It's not a sole factor. Obviously, parenting has got something to do with it, as does attachment issue and how your child then can develop cognitively in a healthy manner. Of course, that has something to do with it. I mean, of course, but that's not the sole issue, and it shouldn't be, oh, you're not parenting well or you're parenting too hard. I mean, that's not an answer as to why you get conduct disorder. That's just a parenting style.
I think that makes parents feel a bit more reassured that it isn't as a result of just the way that they're parenting their children. It's much more complicated.
No, it's multivaried.
Yeah. And I think if we can also promote that message that if it was that simple, all children would be these idyllic angels and there would be no mental health issues or no other issues out there. And it's just not the case.
No. And a way to think of it, I always like to try and make it compared to a physical health problem because it's always easier for people to imagine that. So imagine you are the most healthiest person, you eat organically, you've been running since you were 10 years old. Yeah, our image of ourselves that we wish we were and think we are, we're not. Imagine you live in the countryside, no pollution, you've done everything you possibly can, you can still have a heart attack. So you can still do everything by the book, but that doesn't mean you're not going to get something because it's multivaried. And that's just with mental health as well.
I love that analogy. That is a good thing to think about, is that life isn't that simple.
It's definitely not simple.
If only it was.
I know.
It'd be too good, wouldn't it? Just coming back to the link, you said that sometimes, or that there is a link between these conditions and ADHD and autistic traits. I was just wondering if you could go in a little bit more detail into that, because one of the myths that I found is that ADHD and oppositional defiant disorder are the same, or that they're interchangeable. And so people get them a bit confused.
So, okay, they're not the same. So oppositional defiance disorder, to make it clear, it's, again, in layman's term, a child doesn't control sort of their outbursts, and that's typically seen at home. But you don't have the animal cruelty, the viciousness, the physical harm almost that you have in conduct disorder. And conduct disorder is more likely to become antisocial personality disorder, whereas oppositional disorder not so much so. But with the link with other mental health illnesses such as autistic, I mean, this comes with the biological and genetic factor as well, and how you're developing prenatally. And I can go in, I mean, autism and autism spectrum, I can go into a podcast. Yeah, it's a huge topic, and we'll definitely go into that and what actually happens in the brain development. But you have to remember, because this is also biological, there are brain changes as well, which I mentioned what happens in conduct disorder. So because of these changes, you are more at risk of other health problems. So going back to the analogy of a heart attack, if you have a heart attack, you put yourself at risk of other vascular conditions almost. So it's all very interchangeable. And I know people like to think of things in a box. So, if you've got autism, you can't have that. But things are very interrelatable, such as if you have diabetes, that increases your risk also of other vascular problems.
Diseases, yeah.
Yeah. So it's all very interchangeable. But oppositional disorder is not the same as conduct disorder. But if you like to think of it, it's just a very milder form. But that's not saying it can't become conduct disorder if it's not managed appropriately and the child isn't supported.
That is interesting. Another thing that I was able to look at was this issue, again, it's kind of other people judging parents of a child that has this issue? Because you look at a child and they misbehave and you go, well, it has to be because of the parents. But it's not that clean cut. We've now found that out, and you've explained to us that it isn't that clean cut, particularly with these disorders. But there's also this issue where some children are identified as needing medication, and other parents and other people tend to then judge the person for putting their child onto medication, and that the only reason that they're using that medication is to make their child more docile. So I was wondering your opinions about that.
Right. So firstly, these judgmental people need to go away. No one should judge anybody. But anyway, that's just a side note. No, parents don't want their children to be on medication. And I've seen so many, you don't want your child to be on a medication. It terrifies parents because they think something is pathologically wrong. And it's a horrible experience for a parent to think that, actually. And they rather they not be on medication, especially mental health medication. It really scares them. And understandably so. There are large side effects. These aren't simple, paracetamol tablets. These are hardcore medications that can really impact your child if there's a side effect. Now, you can give medication in extreme cases with conduct disorder, and that decision will only be made by a specialist, a CAMS consultant, psychiatrist. And that decision is not made lightly. So you will make sure that you've done everything you possibly can to ensure the child has the best well-being without medication first, and you'll keep doing that. But if it gets to a form that this child is at risk to themselves or putting others at risk, and I mean physically, and there's no control of that, and there is that concern, then medication will be used, and that will help the behaviour. And that's really important, and it really makes a difference, actually. And parents have seen the difference as well, but that's not a light decision on both sides of the doctor or the parent.
I think that's quite reassuring, particularly for those parents. I mean, I'm not a parent myself, but having that knowledge that it isn't just a thing where the child presents with conduct disorder and they go, oh yeah, medication, that'll fix everything. You've done everything in your power to try and help and support that child. It's just that it's got to a point where this child needs additional help, and the way that that additional help is going to come is through medication.
Absolutely. It's going back to diabetes as well. I mean, if you can do everything in your power to avoid that, and if you're at risk, you do that, don't you? Because the last resort is medication. So it's always a last resort. It's never a first.
Yeah, exactly. I mean, with diabetes, the first thing that is often told to people is to change their diet and increase their exercise as a way to control their diabetes, particularly if it's type 2.
Absolutely.
So, yeah, you can understand. I definitely understand it better, because I know that, I mean, my sister, she has 3 children, and she is constantly worried about their own mental health and stuff. And I don't know if it was necessarily diagnosed as ADHD at the time. I think before they added in the H, it was just ADD. She was diagnosed with ADD, and I'm assuming that there's also this genetic link. I mean, you mentioned on a previous podcast that parents have arrived with a child with ADHD and haven't realised that they also have ADHD.
Yeah.
That she's so concerned about her children and putting them on medication if they were to ever need it. I think having that reassurance that you guys in the medical profession aren't jumping straight to medication is really good, because you feel a bit more like you're on my side rather than on the pharmaceutical company's side.
No, I completely understand that. And I have to say, we are always on your side. Like, we don't want people on medicine. Like, if we could, obviously we want everyone to be healthy and doing it themselves, because you've got the power to. We don't want people to come the most severe cases that unfortunately then we have to put on medication. And if we can, we will always avoid that, because that's not pleasant for anybody.
No. Exactly, particularly when you said that some of the side effects can be quite nasty.
No, exactly. And especially for children, I really am very careful with medication with children, because I really don't like, if I can avoid it, I will really avoid medication, especially with children and as well as older adults, because it can really impact them more than other, late adolescents or adults.
No, that is extremely reassuring. Thank you for answering that particular question.
That's fine.
So I'd like to say thank you once again for joining me on the podcast today to talk about conduct disorder and oppositional defiant disorder. We look forward to you coming back on the show soon. And if you want to get in contact with the Mental Health Book Club, all you need to do is go to our website, which is mentalhealthbookclub.com. You can also find us on Twitter at MHBC_podcast, or on Facebook just by searching Mental Health Book Club Podcast. And if you'd like to get in contact directly with the Secret Psychiatrist, all you need to do is head over to her website, which is thesecretpsychiatrist.com, or you can head over to Twitter, Instagram and Facebook at The Secret Psych. Thanks again for listening, and remember, it is okay to not be okay, and if you're not okay, talk. Thanks for listening to this episode of the Mental Health Book Club podcast. If you need additional help with your mental health, please contact the Samaritans on 116-123, which is a 24-hour helpline. And if you need additional information about mental health issues, please visit Mind at mind.org.uk. Our next book will be Finding Audrey by Sophie Kinsella. If you'd like to find out more about the MHBC podcast, please visit our website, mentalhealthbookclub.com. We really hope that you enjoy this podcast, and we would like to hear what you think. Please head over to Twitter and follow us at MHBC_podcast, or head over to Facebook and follow our Facebook page, which is Mental Health Book Club. If you would like to show your support further, please share us with your family and friends, and leave us a 5-star review wherever you get your podcasts. We are now on Patreon. Please head over to patreon.com/MHBC to donate as little as $2 a month to the Mental Health Book Club podcast. As a result of your donation, you will get early access to some of our episodes, you will get specific episodes that are only for patrons, and you'll be eligible to be entered into free prize draws.